Today I reviewed targeting cyclin-dependent kinases 4-6 in breast cancer. We reviewed first that the biology behind cyclin-dependent kinases and the cyclin D, CDK, RB pathway, its importance in cancer and biology. Specifically in breast cancers, there's been data that alterations in this pathway can not only initiate tumorigenesis but maintain the cancer phenotype, that it can alter sensitivity to estrogen or estrogen-targeted agents. And along those lines, cyclin-dependent kinase inhibitors have been developed for decades. However, the first generation of inhibitors really did not move very far in the clinic. They had a lot of non-specific targeting. They were not specific for any one CDK, but pan-CDK, and were associated with toxicity, which led to the next generation of CDK inhibitors, those that are very specific for CDK4/6. Palbociclib is a first-in-class compound that we were involved in early laboratory development, which led to the clinical development of palbociclib in combination with letrozole in ER-positive breast cancer. This was based on preclinical observations that CDK4/6 inhibition was important in ER-positive breast cancer, as well as there was synergy with anti-estrogens. And we reviewed the Paloma-1 Trio 18 study, which really was remarkable in that the improvement in PFS to letrozole plus palbociclib was from 10 to over 20 months. And this served as the basis for the accelerated approval of palbociclib for ER-positive breast cancer, first-line postmenopausal with letrozole. And we also reviewed the other data with palbociclib in combination with fulvestrant, the Paloma-3 study, which was published in the New England Journal of Medicine this year, as well as the development of other CDK4/6 specific inhibitors, abemaciclib from Eli Lilly, ribociclib from Novartis. Both of them are a little further behind the palbociclib development, but are essentially taking a very similar path, targeting ER-positive breast cancers and various subgroups, in addition in various combinations of anti-estrogen agents, whether it's an aromatase inhibitor or fulvestrant or non-steroidal, also in premenopausal or postmenopausal women. But there's a lot of activity with CDK4/6 inhibitors in breast cancer. It's a very promising area based on the clinical results we've seen so far, and I think we're very excited to see how else we can exploit targeting this pathway.